Good afternoon, everyone. How are you?
Great.
Thanks again for joining, and it's good to have people back after a couple days break. I just have a couple of updates, and then I'm going to hand it over to the folks from Clifford Beers who have a pretty exciting announcement that they've been working on for quite some time. We are up to 730 positive cases in New Haven that are verified. As always, we think the number is much larger than that. But the number of cases that are verified is 730, and we have, as of about half an hour ago, 18 deaths that have been reported through our system. I wanted to share, let me see if I can share my screen here. Give you an update on, can folks see that? Yep. And we're happy to forward this out to you all separately. Gage can forward this out to you, but this is it's the same graph that I shared with you about a week ago. These are just updated numbers, and these are updated as of this morning. So we've gotten a little bit of information in since then. But as you can see, the unknown number has gotten larger, and this continues to be a concern for us that the testing facilities are not getting as much information on race and ethnicity. We obviously really want to know that information to help us respond to it. And also are trying to get a better sense of the people that have been tested that are negative as well, to get a better picture of what's going on overall as far as what communities are impacted. You can see from the heat map that certain neighborhoods such as Fairhaven, New Hallville, Dixwell, The Hill are particularly heavily impacted with COVID positive cases. I have 3 more graphs to show you. This is hospitalizations. And as you can see, in particular, the Black community is much more heavily impacted with hospitalizations that are related to COVID-19. 43% of the hospitalizations that we have had are African Americans, 28% Latinx or Hispanic, and 17% white. And then finally, and again, this is this morning, we've had a couple of reported deaths since then. But there's out of the deaths that have occurred related to COVID-19 that we are aware of in the city, 44% are African American, 19% are Hispanic or Latinx, and 38% are white. Again, we're happy to share this information via email after this. I had a couple quick other updates. We have 4 people now in career high school, and we're happy that that facility is being useful to make sure that we're providing an opportunity for individuals experiencing homelessness to isolate themselves and recuperate. We're very happy that it's been going well, and that that option is available so that people don't have to be discharged to the street from the hospital. And I wanted to encourage people to wear masks. This is a call I made a few days ago. And the reason that it's important for people to wear masks is to keep other people safe. Masks are, just to remind folks, not the cloth masks that we're asking people to wear are not going to prevent you from getting the disease, but they are a way for you to ensure that other people do not get the disease from you. And there's a lot of evidence that shows that the disease is potentially impacting people and they're contagious even before they're symptomatic. So you wearing a mask as you maybe walk around the neighborhood, or especially if you go to stores where you're in closer interaction with other people, is doing other people a favor, is a kind thing to do to other residents in this city. And we've gotten a lot of reports that some people are wearing masks, but a lot of people are not. Please do not put other people at risk. Even if you think you're fine, you may have contracted the virus and just don't know. And so it's so important that you do the right thing for the community and wear masks. And these are easy. There's a lot of directions online to fold a handkerchief, to put it on your face. It's something that we're really encouraging people to do. It's very, very important, particularly in stores. So I'd like to encourage people to do that. And with that, maybe I'll hand it over to Clifford Beers to share your news.
Thank you, Mayor. This is Alice Forrester. I'm the Chief Executive Officer at Clifford Beers, and we're very honored to be here today to talk to you a little bit about the work. You guys are doing an amazing job, and I know that you reached out to us early in the event to think about and consider the mental health and wellness of our New Haven city. And we've had about 60 different organizations working on thinking about what would be some of the efforts we could make. And of course, at the beginning, we were all really and continue to be concerned around the basic needs, food, access, and that is definitely what a lot of volunteers and a lot of folks are doing here in the community. But one of the recommendations was made by a public health expert was developing a warm line. And I just sat in on a city call from New York City and San Francisco and what they've been doing around warm lines. We are, as you know, a community-based organization. We have a long history of working with children and families and adults in the community, and Clifford Beers has started a warm line as of yesterday, which is really not a COVID-19 hotline nor for food, but really around people talking. If there was if we were to call it a compassion line, people who need to talk to someone, maybe who are living alone, that they feel like they want to reach out to anyone, just to hear a voice or, hear about their concerns. It's going to be staffed entirely by Clifford Beers trained peer specialists. And I have Shayla Moy, who's the director on the call, as well as Trudy Piscatelli, who has been, she's the Vice President of Integrated Care, but she's been our health and safety officer for the clinic a long time. Our clinic is open, and we are taking new kids and families and adults living with intellectual disabilities and autism. But the warm line will be open 9 to 7 Monday through Thursday, as well as 9 to 6 on Friday. It's just a place where people can talk, but it's also, we have access to resources, both some gift cards in terms of food support, but also around how to get other resources in the community. Thank you, Mayor. This is our phone number is 203-287-2460. Talks a little bit about what a warm line is, and it's really open to anyone in the city of New Haven who wants to call. If you're out of New Haven and you feel like you still need to call, you can. We're marketing or talking about it mostly to folks in the warm line. Shayla, if you want to, I don't know if you want to say a few things about what we're doing, or
well, I think
who's working the line.
I think you definitely touched on majority of it. So we do have 12 trained peer specialists, peer support staff, as Alice has mentioned. These are individuals who have the experience of working directly with families, reaching out, triaging, and seeing what their needs are and finding resources. They're very resourceful people. They're creative. They're dedicated. So we have a good bunch of people who are staffing the warm line throughout the hours of the time that the warm line is open. Our goal is just, as Alice said, we just want to be compassionate, be an ear for the community. We're here to listen. We're here for them to reach out to us, and we'll reach back out to them and provide what we can provide. And no voice is going to go unheard. We will listen, and we will try our best to provide services, resources that they are requesting or needing.
So we'll be referring folks for mental health services throughout the community. And we will be working with people to access food service delivery, which has been one of the biggest things that's popping up for us. We've given out about maybe $16,000 worth of gift cards, $100 each, but now we're finding people can't leave their homes. And so we're working with community members, and I know the Food Council and people are working on, delivering the services, helping people get food delivered to their house. So our main office is, open for service. You can find us on cliffordbeers.org. But also the warm line right now will be staffed by Clifford Beers. We're not having outside volunteers as of yet. Depending on how much the load is, we'll open it up to other organizations. Does anyone have any questions or?
Any questions? I see Mary O'Leary.
Can you tell me why you do this, I guess, or how successful maybe it's been in San Francisco, and what was the other city? I'm sorry.
New York City.
New York.
I'm sorry, tell me, can you ask that question again?
Yes. Why did you do this? I mean, you saw the example in those two cities, and how successful have they been? I mean, they clients.
Yeah, well, I mean, it's been interesting because first of all, they're sharing all of their information with folks across the country. So we'll be able to learn from them. San Francisco right now has put together a panel of experts to put some procedures and policies together. And the other thing I think that New York City has done, which is designed a warm line for first responders, which I think ultimately may be something that we want to do here in New Haven. We'll have to talk about that as we go forward. But there's been a push for peer support. We're working with DEMAS and CMHC, and some of their folks are trained in intentional peer support, and all of our staff will be trained over this in the next couple of weeks. Actually, on Friday, we're having our first training, and we're also offering that training to other people in the community, other providers. The city, San Francisco and New York are much bigger, but in general, I think we're keeping up with them in terms of offering all of the services that we've been doing very similarly, the food service as well as now the mental health warm line.
So was the food service was just something you found that had to be addressed? I mean, you weren't starting out to do that? I mean, that's not usually what you do, is it? I mean,
yeah, this is not something we've done normally. We have our general answer, we answer the phone and we take open access folks. People can walk in and get services, but we've never done a warm line. We were awarded, Clifford Beers was awarded a CMS grant starting in November that is working with kids and families 0 to 21 and pregnant women. We're in the planning phase right now, but we felt like this warm line was a good start in a crisis emergency to be able to reach out to people in the community, and that they could reach out to our community providers that we're connected with. And so we're hoping actually to keep the line up, for a while. This is not certainly something that's going to end, when we go back to business. So we expect we'll be able to keep that open for ongoing, and maybe throughout the project when we're doing the integrated care for kids, if we can continue.
and you're going to start on Friday, this Friday?
Yeah, actually it's opened yesterday. We had a couple calls, but we're just advertising and sort of marketing the material, and the mayor will do, and I'm hoping the district will send out, a call that people can call in. So we're just beginning to market and promote the line.
But Alice, to be clear, so the line is open now and ready to go. Is that correct?
Yes, it is. Yeah, there people are ready to answer.
Thank you.
I saw Tom's hand up.
Yes, thank you very much. Alice and Shayla, I wonder if you could give us a few examples of questions that some peer support specialists might ask someone who calls, or how a conversation might transpire as you imagine for this warm line.
So I would just imagine that they're going to answer the phone. I mean, when you call, they're going to answer the phone, just announce, good morning, good afternoon, good evening, reach out New and how can I help you? And it's just really about the caller just dictating the call, like whatever is needed, they'll listen, and they're going to kind of listen and hear what the family is looking for, and be as resourceful as they can be. I'm filling questions from any area of, just want to know about school information. They may want to know about food resources. They may want to know about, where could I get more information on the COVID-19 information. It's not necessarily that the peer support staff is going to give out information on what's, on COVID-19, but they have the resources to direct them to that. They can transfer them directly. Instead of having them hang up and try to call, they will transfer the call to them. If it turns that it is a crisis, something that needs something more immediate attention, is not something that they can handle, they will transfer it to 211 for our crisis availability, or 911 if need be. So I
think it's also important to remind, we have both Spanish and English language answer people. So if it's a person who wants to speak in Spanish and ask the questions, we can transfer them to, there's someone who's bilingual on each of the shifts during the calls. The clinic has been getting, the clinic has always been interested in addressing social determinants of health. You see that as a lot of the underlying issues around mental health and trauma. We've been getting a lot of requests for help with some particular problems. For example, we had a family who had two of the three adults living in the house were COVID positive and couldn't leave. And the grandmother had no transportation to be able to even use the gift cards that we were able to give. And so we were able to connect them to some volunteers through the volunteer hotline United Way, as well as some of our staff were able to do some porch delivery of food. And that's been ongoing now for about 2 weeks. So, really trying to not only listen, but also to try to help access the various really wonderful resources New Haven has for volunteers in the community.
Thank you very much.
We've raised about probably another $40,000, $50,000 through philanthropy and United Way to be able to address some of the basic needs of our families. We're worried about computer science. We're having a lot of families that only have one Chromebook for amongst multiple kids. And so we're trying to figure out ways to access some resources in that way. And I know the mayor is too. I'm hoping some come down, I think through the state coming up. Is that correct? Yeah.
We're having conversations with multiple funders, and the Dalio Foundation Dalio Fund has committed, or the City of New Haven has asked them for Chromebooks for high school students, but that doesn't cover the entire gap. So we're looking at other ways to fund more devices for New Haven public school kids to have access to online education.
Yeah. That's one of the other problems that we're running into, in particular with telehealth. Dalio funds part of our project in schools. We're embedded in 12 New Haven public schools, and we've been working very closely with the principals, sort of to be a resource line for them in the various schools. And we also mentioned that, so hopefully that'll support some of your requests going forward with them. We are definitely worried and hoping we can get some hotspots. I know that New Haven has some already, but working with even just getting some sort of phone systems for them to use.
Are there other questions from folks?
I have some questions, not for the Clifford Beers group, but for Mayor Elicker and the health team, but I'm happy to wait until others ask.
Go for it. Go for it. I don't see anyone else raising their hand, so.
We're good. Thank you.
Thank you.
Alice, in the Clifford Beers team, do you mind hanging on for a second in case any questions do come up? Okay. Go ahead, Tom.
Do you have an update on local nursing homes that you said saw a spike in COVID cases, in particular Mary Wade and the Grimes Center, about how they're doing at containing the spread, and any other updates about nursing homes?
Director Bond, do you want to weigh in here?
Yeah, so good afternoon, everyone. So what we've been doing is using a proactive approach, and through partnership with the Department of Public Health and our local health department, we've had ongoing meetings with the nursing homes that we are concerned about. They are in receipt of additional PPE today from the state. So we were happy to hear that that delivery made its way to the nursing homes to help with the capacity issues that everyone's being faced with, but in particular nursing homes. And so, yeah, so we are having ongoing conversations and proactive conversations to ensure that we are, containing the virus within those, within that specific sector.
And is there a site that's been designated by the state for nursing home residents who are released from the hospital but can't go back to their nursing homes? Do you know, for New Haven nursing home residents?
Can you repeat the question?
Where are New Haven nursing home residents released to after they leave the hospital? Do they go back to the nursing home, or is there somewhere else?
So right now, there are some inpatients that remain inpatient until they get through their incubation period. So we are monitoring that, but they do get relocated back to the nursing home if they are hospitalized.
And the hospital has a policy of testing them twice, and
Twice.
and they have to have two negative tests before they're released back to a nursing home.
Thank you, Mayor.
You're welcome. Is that good, Tom?
Yes, and then I do have one more question, but I know I've asked a bunch, so I'm happy to defer for a bit.
I'll go to Mackenzie and then back to Tom. Go ahead, Mackenzie.
Thanks so much. I was wondering if you could elaborate a little bit more on the unknown cases in terms of the racial statistics that you were providing for COVID-19 in the city. It just strikes me as a large number, and I'm wondering, when you anticipate having demographic data for those patients, and if there are any specific places that aren't providing demographic data, and if so, why?
Yeah,
that's a great question.
It really is. It really is a good question, and it's a concern that we obviously have as well. And so, because this pandemic evolved so quickly, individuals that are requesting these testing orders and submitting the forms are just moving too fast, and so it's really a human error. And so, we issued an email communication to those facilities about a week and a half ago, and now we issued a memo today to remind to complete all of the fields so that when the data does come in, we have a complete picture of the demographics that we're looking for.
So the kind of new unknown cases, are those all cases that have appeared in recent days, or did some of the previous unknowns now become knowns?
The data fluctuates. It's a static view, and so that's why we're always, when we update our data, it gets cleaned out. So there's sometimes a fluctuation of our data that gets filtered to other towns because somehow they got into our system, and so it could fluctuate that we get a test that was perhaps a week ago into our system. So when we show our mapping, we're able to track from the exact date. So we do get the exact test date, but sometimes the dates do fluctuate based on the filter when the data is filtered and monitored, when they do a system cleanup.
All right, and then just one final follow-up on this. Are there any particular testing sites that you've been consistently getting incomplete data for? And are those local sites, or are some of them like state or federal testing centers?
It's a statewide problem.
All right, thanks so much.
You're welcome.
Let's go to Mary and then Tom.
I guess it's just a follow-up question. When you go back to these agencies that give you the original data, do they fill in the correct fields? I mean, can you catch up and correct them all?
Director Bond, you're on mute.
So our data comes in through the surveillance system. So it's something that needs to be worked through statewide. And so that's why our messaging was local, but it needs to be corrected statewide. And so we're hoping that we can, once we receive that information, we will certainly input it, but it's going to take a big lift for us to be able to get them to backtrack, because we continue to see the numbers increase. And so it is our hope that they start correcting these measures as of today. We actually sent out a message a week ago. So if we get that data, we will be updating it as it comes in.
Okay. The two specific nursing homes that were talked about before, Mary Wade and Grimes, have the internal numbers changed? I mean, it was pretty specific about, it was 10 at Mary Wade, either 47 or 49 at Grimes. Have any of those statistics changed as far as more patients having COVID?
I don't recall sharing specific data at specific nursing homes, so I'm not really
That
sure.
was on your day off. That was on your day off. That's when
Oh,
I was
this
at
is
the
what
wheel.
happens on my day off. So there has been some fluctuation on the data. There's about 3 different nursing homes that we are monitoring right now. There has been, with the Grimes Center, it has been steady. There hasn't been any increased cases, but there are higher numbers at the Grimes Center that since the report date, and then the other centers we're closely monitoring, and we'll be looking at that data closely.
Can you tell us what that third nursing home is?
I'm not going to disclose that right now, but I will share that once we at least give them a heads up that we're going to be including them as part of because it was a recent nursing home that we just were notified of. So at least once we have our meeting with them, I will inform them that it's going to become public information.
Okay. I'm not sure if they, I forget if we had information on how many people were hospitalized in those nursing homes, or if they were still, it was just an internal care system.
From the nursing homes?
Well, those, Mary Wade and Grimes.
So a lot of them become hospitalized, and it fluctuates when they return. And in regards to what the mayor responded, they do not return until they test positive, negative twice. So the Mary Wade had most of their positive cases. They were hospitalized, and they had not returned as of our last meeting.
Okay.
But I have to say they have been proactive in making sure that they're following protocols.
All right, but you said there is an increase at Grimes.
There was an increase from the number that you just reported, but it's been no additional positive cases since the last update that I had with them.
Okay, but that's an update for us because we got 49 or 47. It was unclear.
We have a different number. I can share if you want, Mayor.
When's your next day off?
I know. I see. I'm looking at him through the computer here.
I see Kyle has a question.
I do. Hi, guys. Wondering if there's an update on the testing centers. I know that we're going to have waiting an announcement, and it's been reported that there's going to be something at Gateway.
Not any concrete updates. We're making some progress on our end to try to increase access to people that may not be able to use other sites because they're drive-through only. But otherwise, we don't have any updates.
That was it for me.
Thank you. All right, we'll go back to Tom.
Thank you. And so that's no updates on the former Gateway on Long Wharf that Mary wrote that great story about this morning. You don't have any updates on?
Correct, no updates.
Thank you. And I know Paul just published a story about this, but is there anything that you could say about local African-American funeral home directors reporting significantly higher fatalities in the local Black community than you all have reported so far in terms of that demographic specific data?
Sure. Obviously, if there is a discrepancy, then that's a real concern for us. I don't know if you all recall, but early on, we had reported 2 deaths and found out that one of those deaths was not properly recorded through the system. And so we want to make sure that the information we're sharing with the public is accurate, but also more importantly, we want to ensure that we have an accurate picture of what's going on so that we can respond accordingly. It's concerning to hear that there may be some potential discrepancies between what funeral directors are experiencing and what our numbers look like, we'll be looking into that. I think it's hard for us to know what the actual reality is there and why that may be the case. It may be that there's some cases that aren't identified as COVID cases of people that died. It may be that there are people that say they're from New Haven, but are actually from the region, and that's why we don't get that information. We don't quite know why that discrepancy might exist, but we will be looking into it.
Yeah.
And that's it from me. Thank you so much.
You're welcome. Any other questions? I'm surprised no one asked whether I got a haircut. I did, in fact, get a haircut at Natalie Elicker's hair salon. So we'll see you all very soon. Thanks, everybody.